Hi, my name is Dr. Brent Miller, and I'm with Alpine Orthopedics. Been there for 8 years, and I am their hand and upper extremity specialist. I see a lot of arthritis because there's an older population here, and arthritis of the base of the thumb is about 10 times more common in women than it is in men. So I see a lot of that. I see a lot of carpal tunnel, a lot of cubital tunnel, which is your ulnar nerve being squished at the elbow. I'm the only one in the valley who does an endoscopic cubital tunnel release. I'm going to say about 4 years ago, I started doing the elbow or the ulnar nerve endoscopically. Before that, it used to be that you transposed the nerve or took the nerve from behind the elbow to in front of the elbow. Basically, you're taking a shortcut instead of having to go around the elbow. Several years ago, the literature started to indicate that you didn't necessarily have to move the nerve. All you needed to do was release it. Well, if that's the case, then instead of making this horrendous incision to release the whole nerve, why can't you do it through the scope? And that evolved into a 1-inch incision with a plastic cannula that allows you to go right along the nerve, and then when you put the scope in, you look down at the nerve, and then you'll turn it 180 degrees and look up at what you're going to cut. And that, once you cut that, it takes the pressure off of the nerve, so it's releasing the nerve. The great part is the patient has 3 or 4 stitches at the elbow, bulky dressing, no more splint. It used to be you had to be tied up for 3 weeks because you didn't want the patient to straighten the arm and flip the nerve back where it was before. Well, now you don't have to worry about that being flipped, and it's really revolutionized how my care for the cubital tunnel patient is, and it's less complicated and a better recovery, and so patients tend to like it much more. So I'm more inclined to say to a patient, the operation is definitely a viable option for you, and I'm not as hesitant to recommend it because it's easier for the patient.